this is something that's also known. This tightens the entire body, right, Doctor?
Right. This is something great. This is the newest radio frequency device approved by the FDA. It's called exilis. You can tighten skin on the body, the arms, the back, the neck.
Does this replace liposuction?
No, it doesn't replace liposuction, but you can recontour the fat and reduce fat. What's so nice about the device is pretty much painless. You do it every 2 weeks for about 4 times. You see the results after the second treatment. You simply scan the skin. It tells you how warm the skin is getting
is that hurting you?
by the temperature. And you can also change the energy levels where you're cooling the skin and heating the fat to reduce and take off inches.
This has reduced you in here?
Yes, we have some before and after pictures of the patient. So you're tightening and you're reducing and removing inches. Notice the before and after. Notice the improvement in the love handles. And this is great because you can virtually have no pain when you do the procedure. A patient comes in, they leave, they're fine.
We thank you, Dr. Brandt. Stick around. I'm going to have everything done. As soon as this is over, I'm going to do everything that's here, right? Not really.
This video will demonstrate the proper technique for treating the abdomen using the layering protocol. Layering simply means that the energy will be delivered to the various depths in the adipose tissue. By changing the cooling during treatment, it will allow you to treat the deep adipose tissue all the way up to the superficial tissue, ending at the dermal layer. First, assess your patient while standing. Palpate the area to determine the thickness of the adipose tissue. This will guide you as to which initial cooling setting needs to be used. Typically, if you can grab a roll of adipose tissue, set the initial cooling at 10 degrees Celsius. If there is less tissue, start at 15 or 20 degrees. Next, determine the amount of time needed to treat the area. After assessing the patient and choosing the appropriate start settings, position your patient comfortably and apply mineral oil to the treatment area. Treat using slow, large circles. Be sure to apply adequate downward pressure to ensure full contact of tip to tissue. Move around the entire treatment area to produce homogeneous heating of the tissue. Typically, the abdomen is the largest area to be treated. This combines both the upper and lower abdomen, making it one area requiring approximately 30 minutes of treatment time. All other body parts are treated as a single 5x7 area and will require approximately 15 minutes of treatment time. When treating the entire abdomen, it will take approximately 4 minutes to reach the therapeutic temperature of 42 to 43 degrees Celsius. Continue treating at your start cooling setting for 5 minutes. If your start cooling setting was 20, after 5 minutes, adjust the cooling to 24 or 25. Again, the goal is to maintain 42 to 43 degrees for 5 minutes at each level. You will keep repeating this process until you've reached the most superficial layer of fat or skin. The last 5 minutes are spent with the cooling off to treat for skin tightening. Remember, your goal is to treat the deep layer, middle layer, and superficial layer. This is achieved by changing your cooling setting throughout the treatment. It is easiest to reach therapeutic temperature in the shortest amount of time by using the highest power settings. Once you've reached 42 to 43 degrees, you may need to adjust power to maintain this temperature and patient tolerability. The large applicator is designed so that you can make changes to the watts in cooling right on the applicator. To change cooling, press the left arrow, and you will see the cooling setting illuminated. Now use the up and down arrows to adjust cooling. To change watts, press the left arrow again, and you will now see the watts illuminated. Use the up and down arrow to adjust. As with all exilis treatments, when therapy is paused for any reason, it is important to minimize the pause to no more than 15 seconds, as the treatment area will cool very quickly. When treating, consider using 2 hands, as this will give you better control of the applicator, as well as help reduce the strain on your arms, hands, and wrists. Proper ergonomics is key. Figure out which position works best for you. Remember to use patient feedback first and skin temperature as the second indicator to determine appropriate power settings. Be sure to instruct your patient that they should feel intense heat during the treatment, not pain. If your patient reports feeling a hot spot, simply avoid treating that particular area for a few passes rather than decrease your energy. If your patient says stop again, decrease the energy to maintain maximum tolerable temperature. Always consult the treatment settings guide for appropriate treatment parameters.